I will say it's one of the last slides I have, but I think one of the most important things to take note of when you're helping somebody with toileting and bathing is that just to know that you are going to have to take care of yourself to be able to have the energy, the patience, the strength mentally, emotionally to help somebody with toileting and bathing. Sorry, I need to turn my phone off. Because there's a lot to it. A lot of the times we see people start thinking about, do I need to place somebody when they're having a hard time with bathing or a hard time assisting somebody with incontinence? Because that's when it becomes, I mean, it's a lot anyway, but it really becomes a lot when you get to that part of the disease process. And we see a lot of that, it's especially if it's a fecal incontinence, it becomes, this is time. I can't really do this anymore on my own, right? Or I need to change my role in caring for somebody like this. A real quick overview. We're talking about bathing and toileting specifically, but these are self-care activities that we do every day. We don't think about it, and we've been doing them by ourselves for quite some time, and it's our well-being, it's our ability to function. And when we start to lose that functioning ability, quality of life declines. Not only for me that's losing that ability, but also for those that are caring for me. And it really does start with a thinking ability, maybe the memory ability, and will eventually come down to the physical ability to doing it. So we're going to talk through how to help in all of those areas. Really setting everybody up for success. And you want to make sure the environment or the surroundings are set for success. And this is, particularly the bathroom, right? You want to make sure it's safe. We'll talk some more about that. You want to make sure it's friendly and inviting in a place that I don't mind being here for a period of time. It's familiar and it's functional for both you and your loved one to work within the space. Ongoing, just setting you up for success for all self-care activities. You want to make sure they're staying stimulated physically, emotionally, mentally throughout the day. It helps prolong their independence and it helps prolong their abilities to a certain extent. Routine is also very important. And this is just the big routine of the day, but also small rituals. When we get into the bathroom, what's my ritual or my routine in the bathroom, right? And sticking to that routine is going to help with the independence, but help with the dignity part of it and help with it being less challenging. And to use aids where it's needed. There are aids out there that can help both you and your loved one do this a little bit better. In starting off, so we said it starts with thinking abilities and maybe some memory issues, and then it gets more into the physical abilities. So we want to be able to help them and match their abilities. We want them to still use what they have left to use, to be involved in these very private activities, right? So it might be that we start with just some verbal instruction or a verbal reminder that, hey, we're about to have dinner. Why don't we go use the restroom first before we do that? That's a gentle reminder of, have we gone to the restroom recently? We're having church tomorrow. Why don't we go ahead and take a shower so we can be ready and fresh for that tomorrow? Just a nice reminder to where it might be that we are giving verbal step-by-step instructions while we are also visually helping them, visually acting it out. If we're going to go brush our teeth, we're going to get washed up for the day. We just visually act out everything. It's a prompt for them, or doing it alongside them. Whether I get in there and I brush my teeth with them, or if it's appropriate, I get in the shower with them. So I am able to show them how to bathe because they're watching me do it. And usually they can mimic or mirror what your actions are. Or to where we get to the part where we're actually physically assisting them, right? Where we are actually using their hands to get into there and wash their hair or wash their body or help them pull their pants down to get on the toilet. So there's a progression to this. Verbally, you want to make sure when you are using verbal cues or when you're talking them through the activity that you only give information needed. It's short, it's concise, it's concrete. and use their name to keep grabbing their attention. Visually throughout the home, we want to make sure like there is a sign on the door to the restroom so they know where the toilet is. Or as we demonstrate the activity to get them out, if y'all can see, we're going to get your belt undone. And then we're going to pull your pants down and show them until there comes a point where we might need to touch them and help them do it themselves. Our approach and our communication are going to matter. Probably the most important thing in both toileting and bathing, how we approach them and get them ready for the activity is going to be important, because if they misunderstand what we're trying to do, then that can cause a fight, or you lost them, or they don't trust you, you try to do something else, you try to trick me into this. So our approach and our communication matters big time. A lot of that's our body language, going at their pace, and using visual cues to help them process quicker what we're actually trying to get them to do. Of course, a big part of these is the privacy and the dignity, and how do we maintain that dignity throughout all stages of the disease, and throughout all, even if we are physically helping them on the toilet, from getting their pants down to helping them clean up and get their pants back on. How do we maintain that dignity throughout the entire activity? Knowing that their senses are changing, so they're interpreting the world a little bit differently than we are. Yeah, there's a limitation in some of the 5 senses, but it is I might not understand. I might see it, but I don't understand what it is. Or I might hear it, but I don't, or feel it, but I'm not sure what that is. And that can be very confusing. It can be very frustrating. It can be scary at times. But trying to keep ourselves in their shoes or seeing it from their perspective as we're helping them with this. Taking your time, helping them with one step at a time, one thought at a time, and helping them be successful before you move on to the next one. And participate together. A lot of this is, I need to do this with you. And doing it to them is going to cause more of a battle. So let's do this together and participate with them in the activity. Of course, encourages and reassurances throughout the entire thing. We say they don't remember that they don't remember that they don't remember. They also don't remember our reassurances or our encouragement. So we got to keep saying them throughout each activity, throughout the day, throughout the weeks and months. Have everything ready. You don't want to get into the shower or get on the toilet and, where's the shampoo? And then we got to get up and leave, because then you've just lost it, or you've lost them. It's going to be really hard to get back to where you started. So have everything ready before you get going. And of course, being flexible and patient. But I'm sure y'all do that all the time, 100%. Y'all got that down. So with bathing specifically, challenges that come along, most important challenge, I believe, is just the embarrassment. They're exposed, and when we're exposed and maybe naked and somebody's in there with me, I'm so vulnerable. And if I can put myself in their shoes and I'm confused and I just feel exposed and maybe I'm cold, how would you act, right? If you didn't have your words or a logical thought for it, how would you act? A fear of falling is also very common. A lot of falls do happen in the bathroom, or a fear of slipping. So that might be the reason why I'm resisting getting into the shower or even getting into the bathroom in general. Or that memory loss. I've already bathed. 2 or 3, 4 days can go by and they are not aware, or at least aware they haven't bathed. That sense of time is gone. And it goes pretty early, especially with those with an Alzheimer's diagnosis. And also just a general rebellion, right? It could be that they're tired of doing what you tell them to do, or they don't want to, or whatever. It might just flat out be, I don't want to right now. Right now is not a good time for me. And we're trying to maybe force it, or it's being perceived that we're forcing it, so they're going to push back. If I push my agenda at you, generally we push back and it becomes a battle. It could also be depression, just a general lack of caring for that. They can be uncomfortable. The bathroom sometimes can be uninviting. I think one of the big things, especially for bathing, is it is cold. It is just cold in there. And I don't want to be cold by any means. So Confusion of what's being communicated. Again, I may not understand my surroundings, and I may not understand what my internal signals are, either internally or externally, right? I just got a message that we've lost audio. Can y'all hear me? Or on mute?
I can still hear you.
You can still hear me? Okay.
Yeah, I can still hear you too.
Okay. All right. Kathy, I don't know. Maybe you sign on and sign back off. She can't hear me. So we'll get back to this. Afraid of showering and bathing. So again, it's the changing senses. A lot of times they don't see the water, and so if they're not seeing the water and they're just getting hit by the water coming down from a shower head, for instance, and they're feeling it, they may be feeling it differently also. So it doesn't feel like running water. It might have a lot more pressure. It might be harder than what we would perceive it as, or it might feel like they're being stung by little things as well. So that might just hurt. And the sound of running water, if you're filling up the tub with a faucet, they might be interpreting that differently and can be upsetting. Or if the fan is on in the bathroom, it can also be really overwhelming, knowing that they can't filter out noise and background noise like we can. So it might just be really overwhelming, and it's too much, and I'm too overwhelmed, and I got to get out of here. So those are some causes of challenges with bathing, right? We always want to keep it simple and enjoyable. We want the bath time, the shower time, to be an enjoyable experience. So making sure the atmosphere is inviting. It's warm in the bathroom. If you're going to help somebody in the shower or try to get them into the shower, you want to make sure the bathroom is warm. To a point where if you are in there with them, you might be sweating a little bit. It's warm in there because that's inviting. Have music going if appropriate, or if it's not too stimulating. Aromatherapy. Have toys or bubbles if they're having a hard time keeping their hands, they're busy with their hands. You can have little toys in there, or extra washcloths or something to help them keep their hands occupied. Again, keep it safe. We'll talk about some general safety in the bathroom, but have everything ready. Again, you don't want to get in there and there's the shampoo, and now you got to go out and get it out of the grocery bag and come back in because you've lost them. And it's you don't want to leave them alone in the bathroom either. That's a safety hazard. You are, for any shower really, whether they're showering themselves or bathing themselves or you're helping, you want to make sure there's a shower bench in the bathroom. That's going to help with their fear of falling because they have a nice place to sit. But it also is going to help you with your back, especially if you're assisting them. They just need to be seated the whole time. Lifelong rituals and routines. Think about it. When you are in the shower, what do you do first? Do you wash your body first? Or do you wash your hair first? It's what is your routine in the shower? We want to do their routine because that's what's familiar for them. Let them go ahead and wear their glasses and their hearing aids, and that will help with their surroundings and interpreting what's going on. It's okay if the glasses get wet. We don't want the hearing aids to get wet necessarily, but if they help and we keep the water down below it, then let's let them wear them. And then ask yourself, who is helping with the bath? If you really do need help or they need somebody in there just to help verbally keep them along. Is it a child helping a parent? Is it a daughter helping a dad? Is it a son helping a dad? What's going to be easier for the person, right? And you ask yourself, who would I allow to help me take a shower? You just think about the important people in your life, and if you needed somebody to help you with the shower for whatever reason, who would you feel comfortable with and why? And maybe asking yourself that for your loved one too. And giving step-by-step instructions, even if you are physically helping them do the shower. It's we're going to put the soap on, we're going to put the shampoo on the hair. Ooh, get them involved. Just have them smell it. Doesn't that smell so good? And doesn't it kind of feel nice? Yeah, let's get it in there. We're going to massage your head. Oh, and then we're going to rinse it out. We'll rinse out with the shower. What might be something that's confusing or irritating is tilting your head back to rinse the hair. That can cause some dizziness. That's pretty common, actually. So maybe you don't tilt the head back to rinse the hair. Maybe you do. If there's a no rinse shower stuff or shampoo, or you shampoo in the sink, something like that. it could be something like that that's interfering with their ability to shower, their want to shower, really. And if you have a portable heater, if that helps keep it warm, there too that. Skincare is important. I put this on here. It is easier to prevent chapping or sores or skin tears or anything like that if the skin is stronger. So applying lotion often. I mean, our water dries our skin out, and the skin for an older person is so papery anyway. So we want to make sure it's as strong, as intact as possible. It's really easier to prevent it than it is to work. With baths, like for a full hygienic bath, you only need a full hygienic bath or a full body bath, 2 to 3 times a week, unless there is like heavy sweating or incontinence. Other than that, you can do sponge baths, or you can just wash the extremities or the private areas separately, so you're not having to do the whole bathing battle if that's what you're dealing with. And there are other bathing techniques that can be used as needed, like if they are recovering from a wound or something, or a bed sore or something, and you need to do the bath in the bed, then you can do a bed bath, right? You can do a basin bath, or again, you can wash the hair in the sink to help get the hygiene needs met. Engage them by using their senses. I talked about that. And have them participate. Obviously, we want them to be as involved as they possibly can be. Like you hand them the washcloth to wash their body, if they're able to do that. Or you take your hand over their hand and involve them in it. That normal movement for their muscle memory will kick in. That will be a normal thing for them. And so to dry the skin when you're drying off, I would really encourage you to pat dry their skin. Rubbing with a towel can be, their skin can be very sensitive and that can hurt. So just pat dry, or maybe even do a little bit of air dry too, no big deal. And keeping them covered the entire time. If dignity and exposure is one of the main reasons you're having a hard time with bathing, put towels over their shoulders or put it over their lap. And keep them warm. Throw them in the dryer before you put them on. Even if you're having a hard time getting their clothes off to get in the shower, that's okay. I mean, there's no need to have a battle just to get their clothes off. If you can get them in the shower and have maybe something warm over them, when those clothes get wet, they're going to become uncomfortable. It's going to be easier for them to get them off. But they can be covered and not exposed the whole time. It doesn't matter if the towel gets wet. You just get underneath, have them wash underneath the towel, or you get underneath the towel and give them step-by-step instructions what you're doing, right, to help with the dignity on that. Some bathing aids, I'll point out, the one in the upper left-hand corner it's a detachable shower head. So it's a suction cup. You got your detachable shower head you can suction a cup close to the faucet. So that looks normal. The water's coming out where it should of the faucet. It's also, if you're helping them, it's easier for your back. If you can just reach, you're already seated, or already kind of on your knees, you just reach over here instead of having to stand up and grab it. It's easier for you. A shower bench and transfer chair in one. So if it's a tub, you sit down and then you pull your legs over. That helps with safety. Some stair steps. You got to hold on to them. If that's the case, I really just encourage a transfer chair to start off with. And then, of course, long-handled brushes so they can participate in the bath too. So toileting. Again, big challenge with toileting is embarrassment. They're vulnerable. They're exposed. Also, a fear of falling or falling into a hole because they see the hole in the toilet and fall into it. They might also just have a physical problem. Are they constipated? Do they have some prostate problems? Is there an infection of some sort? Is their bladder been excited by too much caffeine or certain foods? Problems communicating their needs. Confused about the surrounding. The same thing with the bathroom. They can get to the bathroom maybe, but they don't know what to do next, right? Or maybe they can get down, they can pull their pants down, and they can sit down and use the restroom, but they're not sure what to do next. Or they didn't clean up, and they pull their pants back on. Now it wasn't incontinence, but now we're soiled, right? Because we didn't clean up properly. May not sit on the toilet long enough to get everything out to have a full elimination. because they're antsy or they're restless. That might be a problem too. Or they're mistaking other things as a toilet, like a planter, a potted plant, or a wastebasket, or a closet. Mobility issues, they didn't get there in time. It's hard to get up out of the chair. They don't recognize the urge to go, so that's internal sensation. They feel it, but they may not know what to do with it. Or they recognize it too late, and they didn't have enough time to get to the restroom. Or they're fiddling with their clothes, and it became too late. It's too much to fiddle with
that. You can turn the light on. I'm not on the camera.
Having a hard time.
Not for my class.
Go ahead.
If you could mute yourself, make sure you're muted. Help with background noise. Thank you. We never want to scold or humiliate, obviously, or laugh or show frustration. I think is probably one of the bigger things when somebody has an accident, because it could be just an accident, not they're fully incontinent quite yet because they didn't get there in time. They didn't find the restroom. They were really confused and didn't know what to do when they got there. So we want to make sure for success, they do have clothes that are easy to put on or easy to take off. We want to make sure they know where the restroom is. The restrooms are labeled with a picture of a toilet with a word. I wouldn't use just words because that can go really so, but I know what a picture of a toilet is, or leave the door open so they see it. And having a routine, and this is important from really early on to get on a routine bathroom schedule. We say roughly about every 2 hours, whether it's a reminder to go to the bathroom or walking them to the bathroom so they see the toilet, or we're actually physically taking them and helping them there. That's really will help delay accidents or delay some incontinence because we're regularly train the bladder to go every 2 hours. Watch their signals. They'll lose the words to say, "Oop, I got to use the restroom." But they might fiddle with their clothes. They might become restless, start pacing back and forth, become agitated, and they're telling you, "I need to use the restroom. I need your help." Here's the thing. Don't decrease fluids, though. Dehydration is common. It can be very dangerous for somebody, but we think, gosh, I can't. It's so hard to help or to clean my loved one up every time. Now that maybe they are fully incontinent and they're in briefs. But if we're decreasing fluids, that's just counterproductive. And but I would say after dinner, I wouldn't give them too much, right? Or I'll give them one drink of water or 1 cup of water or something after dinner. And keeping a diary, any changes in bathroom behavior, whether it's a new episode of incontinence or something that's changed, can be evaluated because we want to make sure it's not an infection like a urinary tract infection or a bladder infection, where there won't be a whole lot of warning signs for it. You might see some behavioral changes or confusion changes, but we want to make sure it's not an infection or it was just an accident. Or maybe they have progressed in the disease. So. If they are having a hard time with mobility, get a bedside or a portable commode to help them prolong that dignity and their ability to use a toilet. And helping them sit down, because it could very well be I'm having a hard time sitting down in any chair, but especially the toilet because I'm kind of afraid of it. There's not necessarily, unless you have a grab bar, which is encouraged, not necessarily an armchair I can sit down on. You might have a raised toilet seat, which will help. But if you have them, what you want to do is verbally cue them through it or physically help them, but have their back facing the toilet, right, or facing the seat. If there is a grab bar, have them grab hold of it, stand beside them, ask them to bend their knees, and then lean their head forward and sit back. That is naturally how we all sit down. We just don't really think about it. Instead of us taking their shoulder and kind of just like, sit down, I got you. I'm not going to let you fall, I got you. Bend their knees, lean forward, and then they can sit down. Way easier for that. If they are afraid of that hole, just put a towel over the hole, and as they're starting to sit down, pull that towel away. Some signs for a urinary tract infection. Urine can be cloudy. It can be bloody. There might be an odor. There might not be any of that either. It might just be you might notice it in their behaviors or their confusion level. They are having some urinary tract infections. You want to make sure that they're cleaning well or cleaning properly. And that might be we do need to wash private areas every day. with some water just to help to make sure there doesn't get bacteria in the wrong place. Increase fluids to help with that increased fiber. And I have heard it's cranberry pills work better for UTIs, a little bit better than cranberry juice. And if your loved one is in briefs or they are incontinent at this point or they're in pads or something, you want to make sure as soon as you realize that they're soiled, you got to clean them up. For one thing, that's for their dignity, right? They may not even realize that they're soiled if they're sitting in some wet clothes, but it's important for their skin care. We certainly do not want their skin to break down and they're sitting in something that's soiled. And also, if they don't realize they're wet or they do realize it, but can't tell you or something, they might start to fidget and start sticking their hands down there. And then it comes up and you either got feces or urine all over them, and now it might be on the walls or it might be on their clothes or it might be on getting there earlier the better. And if you are helping them clean up or changing their briefs or anything like that, wear gloves just for your safety and theirs as well, because skin is so fragile. You might accidentally with just a nail tear their skin. You don't want an infection to get in that way. Some incontinence products, because really it comes down to there are different things. You can do liners, you can do pads, you can do briefs, you can do guards or drip pouches for men. Some people do briefs and pads. Right? They do pads underneath the sheets as well. You got to find out what's best for you and what you need, but also what's the best fit for your loved one. There's a lot of products out there and you want to make sure they're comfortable. And so you might have to go through a few to find out what's the best one for your loved one. Making sure they're clean, adult wipes and cloths. Don't get baby wipes. There are adult wipes, and that just really helps with the dignity of it. And when you are in the bathroom, have your toileting cart or your toileting container, whatever it is, ready and available. I know that some families, as their loved one it is incontinence, they are in briefs full time now, that they have set up a shelf right by the toilet because they can grab the stuff that they need. Because if you're on the toilet and you think, oh gosh, I'm out of briefs, let me go to the garage and get some more and come back in. That's a safety hazard because you left them alone, but then you lost it. If you're outside of the home, you're out walking around or out visiting somebody, make sure to have clean clothes to change into, and always know where the nearest restroom is just in case. So general safety, you have it here. Make sure that you install grab bars, you install raised toilet seat, professionally installed them. Okay. No slip rugs, have those in there. And when you're not at bath time, go ahead and hang that rug up. Don't have it just laying out because that can be a trip hazard in and out using the toilet. Remove the locks from the door so they don't get locked in and you can get in as you need to. And declutter. This is, the cute little toiletries out there, the plants, the appliances like the hair dryers and the curling irons. Put those away because this will make it more functional and less confusing for them. And only have one item to choose from. Like you have one bottle of shampoo, you have one tube of toothpaste, you have one bottle of conditioner, right, for them to choose from. They're still being able to choose what they want to use. And of course, I think most importantly, you've got to take care of yourself and take breaks to have the patience and the energy, mental strength, emotional strength, physical strength. Physically, it's going to take more of you to help your loved one with toileting and bathing. So that was a lot in a short amount of time. Let me see if there are any questions. Please feel free to ask anything you want to add, anything you want to share. Holly had said, yes, adults don't wear diapers. They wear briefs. Mm-hmm. Absolutely. It's briefs.
Yeah. The toiletry was real hard for me with Nancy. I would be so angry by the time the ordeal was done. But showering, that was another deal. I used the method of putting the towel over her getting her wet, getting her wet hair. And I would go through probably 15 towels. Just don't worry about how many, how many you have to wash. And it caught, I don't know. I was trying not to be angry all the time.
But it's hard. It's why you got to take care of yourself, right?
Yeah.
Wilson, that's really true. That whole thing about all the towels and everything,
Yeah.
you just let go of that because it's whatever the standards were at one time.
Yeah.
I started out giving Anne bed baths, and she was pretty comfortable with that. Because boy, after a while, she was like on the notes. She thought she'd already bathed that day, and that was hard.
Yeah.
I had a question. There was a little recipe down on the visual notes on the screen, and I missed it, but it was about dealing with odor, and it had to do with white vinegar. And I don't know if there was something else or not, but just dealing with odor in the bathroom. And
I don't know that I had a.
Go ahead.
Oh, I was going to say white vinegar or vinegar does help with odor. To clean clothes with, you want to do a ratio.
Oh, okay.
White vinegar. I'm not sure I can find it. I can look it up.
Oh.
But even to clean the toilet or something, the vinegar helps get rid of the odor.
Oh, that's good.
One thing that I noticed for us is I took my husband off of anything with caffeine. Iced tea, coffee, sodas, and it was a game changer for us.
Wow.
And he hasn't had that many incidents with fecal incontinence. It's usually been just like an hour or so. And so I have learned to carry Imodium because one time it happened when we were visiting at Thanksgiving in St. Louis. And so I just carry Imodium, and I don't have to give more than one dose of that. But taking off of all caffeine, and I was able to discontinue the Myrbetriq prescription.
Oh, that's good. Wow.
Thank you for sharing that, Marcia. Yeah.
I also wanted to mention about towel warmers. You can buy towel warmers that you put your towels down in. I've got one myself at my own house, and it fits right by my tub, and put the towels in there. And then you can also put heat lamps or heat lights in the bathroom to get the room warm. And Jamie will be sending these slides to everybody this afternoon. So, because that is a whole lot of information real fast. So we'll be sending the slides out also.
Oh, that's good.
We'll need to break that up and do just toileting, just bathing. For 2 separate sessions. We're learning as we go, everybody. We're learning. And tomorrow is Friday. So we have the support group at 11. Holly facilitates that. So we really do appreciate you guys for being on here. I'll email out the slides.
Okay. Thank you.
Thank you. Thank you. That was great.